Hello, my name is Chris Barbary, and I'm one of the chaplains at Floyd Medical Center. In this series of short videos, I will be explaining the Georgia Advance Directive, which has 4 parts. In this segment, I will explain Part 1. Part 1 is called Healthcare Agent. Before you begin Part 1, complete the top of page 1 by writing your full name and date of birth. Part 1 has 5 sections. The first section lets you name a surrogate decision maker, or the person that you want to make your medical decisions if you lose the ability to make medical decisions yourself. In Georgia, that decision maker is called your healthcare agent. This person used to be called a medical power of attorney or a power of attorney for healthcare, and many people are more familiar with those terms. However, in Georgia, the legal term is your healthcare agent. As long as you can speak for yourself, your doctors will talk to you about decisions related to your care. However, if you are unable to speak for yourself, your healthcare agent will be contacted to make decisions on your behalf. Before you find yourself in crisis, you should talk with your healthcare agent and share your medical wishes. You should choose someone you trust to honor your wishes. Naming a healthcare agent can be critically important because without an advance directive, Georgia law states that the physicians must talk to your legal next of kin to make medical decisions. This law also dictates a specific order in determining who is the next of kin. This order starts with a legally married spouse. If there is no spouse, next are grown children equally. For example, if you have no spouse and 9 children, then those 9 children will be your equal co-decision makers. If there are no grown children, parents are the next tier. If there are no parents, then siblings are the next of kin, again equally. There are a few more steps to this ordering if a next of kin still has not been identified. For many people, their next of kin is exactly who they would want as their healthcare agent. However, there are many situations in which someone does not want their next of kin making their medical decisions. I have seen numerous examples of this. For example, one gentleman did not want to place the emotional burden of difficult decisions on his wife and named a close friend. People who are engaged but not yet married often want to name their fiancé as their healthcare agent. Similarly, people who are separated but not yet legally divorced often want someone other than their spouse to make their decisions. One gentleman with no spouse sadly reported that he did not trust his grown children. He named a niece that he did trust to serve as his healthcare agent. Frequently, someone with numerous children will want to name 1 or 2 of those children to serve as healthcare agent just to simplify decision making. The first section of Part 1 boils down to this. You know your family, you know your friends, you know your situation better than anyone else. Naming a healthcare agent in an advance directive ensures the medical team is talking to the person you want them to talk to if you are unable to make those decisions yourself. To complete this section, write the name, address, and phone number of the person you want to serve as your healthcare agent. Note that it is very important to have a good phone number for the person you are naming. The second section of Part 1 is optional and allows you to name backup healthcare agents. Again, please write down the name, address, and phone number for each person you name. Sections 3 and 4 of Part 1 explain the powers granted to a healthcare agent and provide guidance for the healthcare agent. The healthcare agent is agreeing to act in the best interest of the patient. As a reminder, the healthcare agent is only empowered to make medical decisions and has no powers associated with financial responsibility. This guidance also states that the healthcare agent is supposed to use substituted judgment. This means the healthcare agent will do what he or she believes the patient would want. The healthcare agent should not superimpose his or her own beliefs on the situation. Section 5 is optional and is the last section of Part 1. It specifies a few powers the healthcare agent has should death occur. Unless this section is completed and specifies otherwise, the healthcare agent is empowered to make decisions about organ donation, autopsy, and donating the body to science. Section 5 allows you to withhold that authority or to grant that authority to someone else. This section also allows someone to indicate their preference for burial or cremation. Note that this preference is not binding and that individuals must make their own funeral plans. However, putting one's preferences in writing can prevent family conflict by making your wishes clear. In summary, Part 1 is where you name the person you trust to make medical decisions if you cannot make those decisions yourself. That person is called your healthcare agent. Once you have named a healthcare agent, be sure you talk through various medical scenarios with this person and ensure your wishes are known and understood. In the next segment, we'll look at Part 2, Treatment Preferences.